And in our top story this hour, 7 newborn babies are still fighting for their lives at Tembisa Hospital, north of Johannesburg. This follows an outbreak of a Klebsiella pneumonia. 10 babies died at the hospital's neonatal ward in the past 2 months. Overcrowding and the shortage of staff have been highlighted as the main reasons behind the infection. The ward has a capacity to admit 44 newborns, but currently has 90 babies. All right, for an update now on the situation, we're joined on the line by Gauteng Health MEC Dr. Bandile Masuku. Dr. Masuku, good afternoon to you. Thank you so much for joining us here on the SABC News channel. I suppose, firstly, when did the Department of Health learn of the outbreak?
Good afternoon and thanks for having us on your show. We heard about the outbreak. Usually it's after or 2 or so deaths that have happened. But in ICU, it's one of the things that we do regularly, where when you deal with infection, you have to culture the bug that is causing the infection. The initial thought, which was put across, which is a common bug that we deal with, is the Klebsiella. But in this case, it was not the Klebsiella; it was an enterococcal bacteria that we actually found, which was also resistant to one of our advanced antibiotics.
And really, how was this outbreak able to happen with all the specialized medical technology that one would imagine we have in this day and age?
Yeah, I think the basic thing that we need to understand in ICU is that, immediately when you deal with a lot of patients, there are a lot of things that, get compromised. And one of them here, because you have to have a one-on-one nursing. With overcrowding, you end up that one nurse would be able to nurse maybe around 5 babies, which is not, the norm because of the overcrowding that we face.
So talk to us about the state of the remaining 7 babies. We understand that they're still fighting for their lives in hospital.
At the moment, they're doing quite well because we have managed to identify the bug. Remember, what becomes a big challenge is when you don't know the bug that you are dealing with. And the bug that we are dealing with has been identified, and we are managing them quite well. We have since then closed off the neonatal ICU for new admission, and only dealing with those that are still inside. But so they are doing quite well for now.
All right. So as you said that some of the contributing factors in this particular problem is overcrowding and shortage of staff. What interventions are you going to put in place, or have you put in place at this point in time to ensure that we do not see a repeat of events?
We have put a lot of effort in terms of trying to resolve the issues. Remember, one of the things that we do is to identify what could be the common causes of it. And one of the causes that I've indicated was the issue of overcrowding. But I have to say here to the public as we go forward is that, yes, our neonatal ICUs across the province are overwhelmed in terms of numbers. We are seeing a lot of preterm deliveries, and hence the demand for ICU beds has increased. So as a province, we also have to find a way of increasing our bed capacity. At Crisani Baragwanath currently, we are extending and developing a new, bigger neonatal ICU unit, which means that we also have got to have a pressure from the south of Gauteng in terms of beds.
All right. So as you say that the ward has a capacity to admit about, 44 babies. And if we take the Tembisa Hospital, for instance, that neonatal ward has currently admitted about 90 babies. Has the situation been resolved now in terms of the reduction of the numbers?
Yes, currently, like I said, that we are not taking any new admissions into the ward because it's part of the way of managing the outbreak. And we are managing those babies that are inside there in the neonatal ICU for them to be discharged as quickly as possible. The issue of the numbers is a big challenge, and it's something that in a way it's preventable if we do a lot of education in terms of avoiding and preventing preterm deliveries, because these are babies, most of them are the babies that are preterm babies.
All right, Dr. Masuku, we'll leave it at that. Thank you so much for coming through. Dr. Bandile Masuku is Gauteng's health MEC, talking to us about 7 newborn babies who are still fighting for their lives. And as we've been reporting that about 10 had lost their lives at the Tembisa Hospital, that is north of Johannesburg, in the past 2 months.